Yo, yo, everybody, what is up? Physical therapist, Dr. Ryan Welton, coming to you from just outside of the beautiful Tampa Bay area. If you are, actually, I am at home today. So this is the Monday before Thanksgiving. I know all the kids are generally off from school. I was trying to go live on TikTok, but that's not going to happen. I don't know why. Anyways, if you need to follow me, I got a clinic where most people have, like, I call it the I've failed everything story. I've tried this, I've tried that, I've tried this, I've tried that, and I find it to be, pretty consistent in our clinic as to what was actually happening to these people. Um, but the other day, by the way, join my school group below. I click on join my free school group. Okay, there's a link right below. Join that, and or you can go to weltonmethods.com and it should be there in the drop down menu. And anyways, I got a clinic where most people have failed everything type stories, I call it, and then I get exceptional results in that patient population. I have published statistically historic papers in the field of orthopedics. So I have, if you go to my social media and you click on the top, it should be pinned right to the top. If you click on the top, there is a graphic, and the papers I published that I propose are the root cause of SI joint, plantar fasciitis, sacral torsion shear. You can see them. The papers that I published, I proposed that are the root causes of these conditions have statistically made medical history, getting multiple times, not just the biggest journals in orthopedics, but the biggest journals in medicine. According to AI, 3 to 5 years post publication annually. So, there's a reason why that happened, and y'all should check it out. So, all right. So, today I am talking about my last patient of the day the other day. And so the patient comes in. She has tried physical therapy, chiropractic, multiple injections. Um, what else has she tried? Physical therapy, chiropractic, multiple injections, meds, you name it. And she's got this chronic back pain, leg pain, and she has an incidental thing she threw at me. So give me a second. So, but my question was, does it go into the foot, the toes? Because SI joint doesn't go into the toes. So, like, is that coming to, because she didn't have the sciatica right there. So if she had the sciatica, I would just realign her SI joint, open it up, hold it there. Do you have that sciatic type pain? If it's gone instantly just by opening up her SI joint, then to me it's SI joint. You just realign the biomechanics of it, and if the referred pain pattern goes away, then it confirms what it is, right? And she didn't have it there that day, so I was like, okay, well, if you had it there, I'd be able to tell. But the fact that it's going into your toes tells me, at the very least, this is, some herniated disc, radiculopathy, but not all of it, right? So I realigned her SI. She had back pain. I realigned her SI joints, rotated her sacrum back, join my school group. I post my papers in there. Click the link below. You can have my free papers. It is free to join my VIP group, the school group. And so I realigned her SI joint and rotated her sacrum back. Boom, her back pain went away, right? And then she said, I still have pain in, no, real quick, I have pain in my leg, right? And I'm sitting there and I'm like, oh, great. Like, let me just check. So I got her up slip first. I pulled on her leg, read my paper. I got her up slip first. Okay. And then what I did was I held open her out flare of her pelvis. So I pushed medial on the ASIS, and she said it hurts when I walk. So I started walking with her while my hand was medial on her ASIS, pushing medial. And she said, no, now the pain is gone. And in my leg. And I said, okay, well, there we go. We just confirmed that, that this pain coming down your leg that did not go into her toes was actually from her sacroiliac joint, right? So I'm like, okay, well, we got that. We got that. She also complained of knee pain, and but the X-ray was negative. But if you look at a referred pain chart um, of SI joint, you can actually have knee pain. So I've had patients with just knee pain that I open up their SI joints, boom, the pain's gone. And it's like, oh, well, that was that. And a few times I never actually had back pain. It was just kind of like, well, let me just open up the SI joint, see what happens. And they've been to knee doctors and all that stuff, right? So I always clear the SI, but in this particular case, here's where the story gets interesting. I'm going to see if I can get this on video, see if she'll let me. So this patient, she goes, after I like relieved her back pain and leg pain or whatever, she goes, hey, look, she goes, I can't bend my knee in standing, right? So she stood and did a standing, hamstring curl and could only get her leg up like 30 degrees, her heel up like 30 degrees, right? So I'm thinking that, oh gosh, we have a contracture going on, right? So then so then she shows me, she bends it on her own and she's got full passive range of motion. I'm like, full passive range of motion and 30% active, and my first thought was, huh? Like, okay, so that's not a contracture. This is some kind of maybe neurological issue, like the lady's hamstring's not working because of some nerve innervation issue, right? But doing what I do for a living, although I've never seen the hamstring do this, so this is a first for me. If you read my root cause of SI joint dysfunction paper on my school group, click my school group below. It's free, and you can read my paper. I posted in there. If you read my root cause of SI joint dysfunction paper in there, I state that I should not state. I state it, but then I actually link it to videos of this very rare presentation that I believe I might be the first one that got it on camera, of this very rare presentation of two patients with foot drop. And it's been documented a few times in literature from what I see over the history, but like I got this on video. And you can see me go realign these people's upslip out flares, and then boom, their foot drop went from like a 3 out of 5 to like um went from like a 3 out of 5 to a 5 out of 5. It's pretty wild. Okay, now, so I had already realigned the upslip. You got to get the upslip first. So I had already realigned the upslip. So what I did when this patient showed me that she couldn't do a standing hamstring curl, but yet she had full passive knee range of motion, and I'm like, huh, you know. So what I did was I actually pushed medial on her ASIS and standing, hugged them both like this. And I said, now do a hamstring curl. Boom. Her foot came up and touched her butt. And I was like, oh my. I'm like, that was SI joint. I'm like, that's crazy. And I'm like, I thought I had seen all the crazy presentations of SI joint, but that was another one that I have not seen, is straight up hamstring weakness. And I said, have you shown anybody this? And she goes, yeah, nobody knows what to make of it. And I'm like, I bet, you know, pretty wild. But yeah, no, I've seen atrophy in the quad that nobody could figure out, type thing, that you open it up, boom, their strength, more strength than they had comes right back in like a single leg squat. But I have never seen hamstring weakness. That to me was a different game. I had not seen that, but I have seen dorsiflexor weakness. So if you read my SI paper again, I linked it in there. You can actually watch the videos of dorsiflexor. I think I'm the first person to ever get that on camera in the medical world. So anyways, I'm going to see if I can get this. Um, get this patient on video, because if you were to take like an EMG of her, you'll probably say, like, no, there's nothing wrong, with her hamstring nerve innervation or something like that. I mean, this is, uh, I see this kind of stuff all the time in terms of like they do EMGs, but then they come to me and they're like, I don't know, they say I'm faking it, I'm not faking it, this kind of, that kind of stuff. And I'm like, well, let me check for mechanical issues, because mechanical issues don't show up on X-ray and MRI. Now, I have been no stranger to the fact that I believe, in my clinical observation, that the main cause of chronic low back pain is actually usually bilateral SI joint dysfunction, sacral torsion shear. And I say that because I have a chronic low back pain clinic, and I help other people set up a chronic pain clinic, and we see this all day long. Now, before it was kind of a rule out diagnosis SI joint, but I published that diagnostic procedure. So people are using that and they are like, yeah, no, man, I agree with you, Ryan. This is all I see in here nowadays in the chronic, low back pain world and quote unquote radiculopathy is that I keep opening these things up and these people's pain go away. I do your protocol and the rehab with them, and then their pain goes away. And I'm like, yeah, I'm like, it's pretty wild. So that's what I'm seeing in my clinic, and I've seen it for years. So I've actually come to the conclusion that this is the cause of most chronic low back pain, a lot of radiculopathy. Now, if you don't believe me, I publish my SI sacral papers for free. So go to the school group, VIP group. I publish diagnostic procedures and protocols. So you can just test me. You should never follow anybody and believe anything that they say with blind faith. This is not, you know, theoretical physics. Like we are the patient's right in front of us. Give it a shot. Open up pull on their leg, gap open their SI. The outflare, upslip and or outflare, and then rotate their sacrum back using my diagnostic and treatment procedures. And I think that you will find the same thing that I found, which is that like this is the cause of so much suffering in the world. Back pain is one of the leading causes of disability. I think this is what is actually a major driver of it. In my clinical experience, I actually had a lawyer in my office. Her little girl, who was like 15, had this chronic back pain that nobody could figure out. And I'm like, I was talking to mom. I'm like, what type of law do you do? She's like, oh, I'm a disability attorney for the government. And I'm like, oh, I'm like, do you see like a lot of cases? She's like, I'm like, I'm like, I see what your daughter has all day long. SI joint, sacral torsion shear with, chronic low back pain. I said, and they usually have like tried everything and all this stuff. And I'm like, do you see like these people? She's like, when there's nothing, she's like, there's nothing I can do. She's like, now I'm starting to think that, what happened to my daughter is happening to these people I'm denying for disability. I'm like, can you like send them to my like providers and help these people, And she's like, I'm not allowed to, but she was now onto the fact that this is what she was denying for disability. It could have been, and I'm like, yeah, these people, they try everything, but it was a mechanical issue. It didn't show up on x-rays and MRIs. You have to see it move and understand what's happening. I say it's like a Rubik's Cube that twists. And when the Rubik's Cube twists, you have to understand how a Rubik's Cube twists in order to twist it back. But if you can understand it, you can twist it back. If you can twist it back, then you can glue it together. And that's how I describe it to my patients. So that's that. Okay, join my school group right there. I'm talking my advanced clinical mentorship is in there, where I give you 59% off all of my courses. And then I also am teaching live weekly with Q&A. And then I also have my hybrid, another whole thing, my hybrid clinical course. So I own a very successful cash-based clinic that I have taught others how to open and run. $400 for 30 minutes. I have very different. People say, oh, well, nobody's going to pay, go outside their insurance for physical therapy. I'm like, people aren't coming to me for physical therapy. They're coming to me because they're coming for solutions, that I'm a chronic pain expert. Well, the kicker is I do protocols that I teach people how to use in my diagnostic methods with my clinical courses, and then you start working in this chronic pain world, and I mentor people and I show them it's not as difficult as you think it is, you know. So, anyways, there's clinics all over that are popping up and that are specializing in this, and that's my goal. Okay, so whether you want to join the hybrid clinical group, or whether you want to join clinical business group, or whether you just want to join the clinical, just right there, click the school group below. Okay, join that, and I'll see you there. All right, peace. Love you all.